My name's Allyne Topaz, and I came to SIU for their Hand Microsurgery Fellowship program. Prior to this, I was a chief resident in general surgery at the Brooklyn Hospital Center in Brooklyn, New York. That was my last year of training in general surgery. My hope was to grow as a surgeon and to find an area within surgery that I wanted to specialize in. The reality of the global pandemic didn't really hit us until about March, when we realized that what was happening in Italy was going to completely happen to us. We felt falsely secure because we felt that we were in New York City, we have all the resources needed, there couldn't possibly be a situation where what was happening in other parts of the world could happen to us. That was very untrue. We ran out of supplies very quickly. What I saw was akin to what you might see in a third world country. You do not expect to see that those circumstances happening in the United States of America, where you are short on ventilators, converting cafeterias into ICUs, all hands on deck, no matter what your specialty training, and surrounded by people that are dying despite all the medicine we know and all the advances in critical care that we have. It really made no sense, and we were throwing everything we knew at them, and it was just not working. The reality was crushing. When it came full force, we didn't expect it to be of that magnitude, and when we understood how sick people were and that our medicine wasn't working, that we didn't necessarily have the answers, and that we were running out of equipment, both for ourselves and for them, it was bleak times. But I do have to say that that community, that demographic we served was a very low income demographic, but there was definitely a sense of community. People were pulling together, restaurants on every corner, no matter how big, how small, we're sending something. The New York Yankees sent ponchos because we ran out of gowns. We wore those for a while. We wore trash bags. People donated trash bags. It felt so desperate, but it did feel that people were trying to support each other because it was such desperate times. In the beginning, we thought that we had adequate PPE, and there were even committees regarding PPE to ensure that we had enough PPE. About 1 month in, we found ourselves in a situation where we were relying on donations. We were saving our gowns every day. We would hang them up on the wall. We would label them with a piece of tape with our name and save those for the next day or for the week, for however long it was until you could get your hands on a new pair. The same went for masks. We really needed N95s at that time because of how rapidly it was spreading through the hospital. And we did not have enough supplies to change those every day or every 2 days. We often had them for a week or more at a time, and whenever you got a new pair, you could cycle it out. But everybody was in that situation, so you didn't feel alone that way. All of the borough hospitals were experiencing the same thing, but it was unfathomable. It's something you don't think will happen to you in a first world country, certainly not in the heart of New York City. My fiance still lives in New York. He works at Stony Brook University, which is in Long Island. They were a much bigger hospital than us, so they had to establish a field tent outside. I believe it was a 400-person capacity field tent outside the hospital. The hospital is about a 1,000-bed facility. It was all hands on deck. He got recruited for 3 months to the ICU as a radiology resident. We had daily crash sessions where he would drive and I'd walk to work, and he'd drive out there, and we would review pressors. How do you manage a vent? How do you manage hemodynamic instability in general? Things that, critical care elements that he hadn't focused on in actually ever, but were now his responsibility. He was responsible for about 20 COVID ICU patients, intubated patients at a time, and it was devastating. It was actually incredibly emotional, and he watched a lot of people like myself that were our age die or our parents' age dying, and we had no explanation for why things were not working. We worried about resources such as vents. Who would we have to give it to next? You worry about ethical dilemmas that you don't ever want to consider in this country, in a first world country. So I think that impacted both of us greatly.
You bring those burdens home?
I don't think it's possible not to. Yeah. I think if you're human, you have to bring those home. And there was such touching and beautiful stories that happened in the community that you can't help but bring that home.